We are really excited today to present the Forward Movement program, aligning costs and adding revenue during a crisis. On the call today, we have both Bill Lopez, co-founder and COO of Strategic Solutions of Virginia, and Bill Clayton, who is a private contractor for Transworld Systems. So to kick us off, we have Bill Lopez with SSVA.
Thank you, Megan. First off, I want to wish everyone a happy Cinco de Mayo. It's also Taco Tuesday, which from what I understand is rare that those two happen on the same day. So I want to first welcome everyone for joining us for this event. We know your time is valuable. We know everyone on this call is dealing with a great deal of challenge right now during this pandemic. And we're going to make sure that we're very focused in our presentation and the data and information we provide you today. There is ability to answer questions or ask and answer questions. So feel free to use the chat box. Megan will collect those, and depending on what they're about, myself or Bill Clayton will provide you responses. You might be wondering what just, most everyone is always wondering. I know I wonder when I get on a webinar, what is going to happen after the webinar? Am I going to get hammered with phone calls? Am I going to get this or that? I want everyone to know that's not the case. We've created this a program called the Forward Movement Initiative. It's purpose-built for the healthcare community to help them develop a 6 to 12 month plan, leveraging our skills, resources to align their IT costs, potentially even reduce them, and recognize new revenue during a crisis like this. So this is our way of giving back to the community. It's our way of helping you. And right now, the healthcare community is needed more than ever, and this is our way of giving back. So there'll be information, ways to contact me throughout the presentation. So just want everyone to be really clear. There's no sales. This is no sales gimmick, no strings attached, no catch. This is strictly us giving back to our community. So with no further ado, I'll get started. Let's talk about why we're here today, right? So we're just starting to see the economic impact of COVID-19. I mean, we're really at the beginning. The economists that you hear the experts out there, a lot of them are predicting that the economy will contract by as much as 25% by the end of Q2, which is not great. Those are terrible numbers, but it is reality. And what does that mean to us, right? What does that mean to the healthcare community? Well, in the past, it didn't mean a whole lot because historically, healthcare has been recession-proof. People, need care in good and bad times. And in the past, during other recessions we've had, or economic downfalls, health insurance produced or reduced out-of-pocket costs for patients. So people were able to get the care they needed, the treatment they needed at that time. Here's what's different with this crisis. The last time that happened was decades ago, over a decade ago. Today, premiums are much higher than past recessions. Quarantining, the quarantine orders have been keeping people inside, primarily those that have pre-existing conditions, keeping them in home and keeping them all, from gathering and being around others. And medical offices have reduced their service offerings, their treatment options to reduce potential spread of the disease. This combination means less people are going to be in a position to get treatment they need, and will most likely postpone and are postponing visits until times are better for them. So here is what we're hearing from a community standpoint. We're going to talk a little bit about what I'm hearing from my client base, from our market. In fact, today, the webinar today has a mix. We have a mix of existing clients, and we have a mix of others that are interested in the healthcare market community that just want to hear what we have to say and what we're doing. So it's going to be a good mix today, questions and answers. But again, I want to share with everyone what we're hearing directly from our client base. So we know the impacts of COVID-19 are devastating. We know that they're impacting just about every business in the country. How is healthcare dealing with it? Now, here's what I'm hearing. I'm hearing that healthcare leaders are dealing with this in a couple of fundamental ways. They are they're furloughing staff. They're reducing salaries, leadership salaries. I know that for a fact. Physicians' salaries, they're reducing those. They are also closing offices. Those that have multiple locations are shutting down less offices that have less traffic in them, and those are all viable options out the gate. But what happens when that's just not enough, right? What do you do next? And that's really what we're going to talk about today. And I'll tell you that you're probably going to walk away from this webinar with more questions than answers, and that's by design. We want everyone to, at this point, now is a good time to, look, states are starting to come back online. Virginia, I think I just heard that we've got another week or so before Virginia gets rolling again. I know that other states are already starting to turn businesses back up. So now is a really good time to pause, step back, and look at your landscape and start developing that plan for the next 6 to 12 months. And that's really what the Forward Movement Initiative is about, is helping you develop what that plan or roadmap looks like for the next 6 to 12 months. Because none of this is going to go away overnight. It may have happened literally overnight, but none of it's going to go away. And these economic challenges are going to go well into 2021. So having a plan now and start working on that plan now to reduce costs and see how you can recognize additional revenue is paramount. So some questions, just some things that I want you to be thinking about today are, are you spending more for technology than you should, right? Across the board. I don't mean just from your service provider or for an IT staff. I mean, if you were to look at your P&L, what is your total IT spend, right? Where are you spending your money on technology? So we're going to talk about that today. How do you determine if you're spending too much? If furloughing IT staff is required, how do you identify those roles and how those responsibilities handled? If you're currently using an outsourced service provider, what kind of questions should you be asking them now, right? And we're going to talk about those things. So you're going to walk away here with a little bit of a playbook on next steps, on things you can put in play right now. And then what is the health of 4 of your key vendors that your business relies on? Okay, so these are just a couple of the basic questions we're going to go through today. So if we're just focusing on staff reduction, right? If you're reducing staff, and when I'm talking about staff, I'm talking about IT staff. So if you've got in-house people that are doing this for you, before anyone is furloughed, right? It's imperative that you have comprehensive documentation on what they do, right? So I know sometimes, the reason I bring that up is because I'm seeing so many practices that are moving at breakneck speeds that sometimes these things haven't been thought through. And I can tell you that what you don't want to do, and I'll say this probably more than once on this call today, you don't want to take one problem and turn it into another and into another. So it's imperative that anything anyone's doing IT-wise for you on the inside, there's good documentation, so that if that's being handed off to another person on the inside or to an outside service provider, you've got documentation on how those functions are handled. You don't want to furlough someone and then figure out that what they were doing, only they knew how to do it, and they took that information with them out the door. So documentation is key. If you're going to furlough someone, do you have a plan to fill that role? You're either going to have to outsource it, or you're going to have to ensure that you have a resource internally that can do that. Again, the transition must be seamless to your business and your customers. And here's why I say that. I say that because right now, everyone is running on fumes. Everyone right now is suffering right now, feeling the brunt of this, or the impact of this pandemic. So there's no runway, right? I use the term runway a lot. A plane's landing and it's running out of runway. That's not good for the plane. There's a chance that plane's going to crash when it lands. So we don't want to shorten the runway by making things more difficult when you're doing a staff reduction. Just make sure you've identified that person has the skills, or you've identified a new service provider partner that has those skills, and you have the documentation on what that person was doing, so that it's as seamless as possible transition. Okay. Connectivity. Everyone on this call has internet connectivity, right? That's old news. The question is, are you paying too much for that connectivity? How do you know if you're paying too much, right? So this, there are ways to measure how much internet bandwidth you're using and to really right size what you're doing there. Now, you're probably thinking, well, how much am I going to save doing that? Believe it or not, you can save a significant amount of money if you're paying for a very large internet connection and you're using a small percentage of that. You can right size that. You can redo your contract with your service provider, internet service provider, and save yourself dollars. And those dollars will add up, I promise you. So again, be thinking about, what am I paying for internet, and do I need that much, right? If you're using a technology like MPLS, connecting your offices together instead of internet, that's very expensive. And I will tell you that the market trend that we see, and we've been seeing for the past few years, has been going away from MPLS and using redundant internet connectivity to reduce costs and still maintain same or better performance. So if you're spending money with Verizon or with whomever, Cox and whoever is your local service provider on MPLS circuits, that's an opportunity to really look at that and understand, do you really need that? Is there a better way, a lower cost way to do that? The third type of connectivity that is the most overlooked we see are POTS lines, plain old telephone system lines. These are the lines you primarily use for fax machines, though some of the older phone systems today have POTS lines in them. These things are expensive. They are about $40 to $60 each. What we find when we go into a healthcare practice is 15 to 20% of those lines aren't even being used because over time, those fax machines have been turned off or decommissioned, but the line never got turned off. And the accounts payable person is just writing a check each month, not really knowing whether these lines are active or not. So that's another opportunity to save a significant chunk of money, is doing an exercise where you're taking stock of your POTS lines, your telephone copper lines that are in each of your offices that you're using. So connectivity strategy, that's something else, where you get another opportunity for you to reduce costs. Software and hardware is something else that we always talk about with our clients. Are they paying more for software licensing than they're using? I just went into a behavioral health practice recently with 400 users and found they were using 30% more Office 365 licenses than they needed. And they were the wrong types of licenses. They were spending an obscene amount of money with Microsoft and didn't even realize they didn't need to be doing that. So it was more about getting the counts right and a right sizing type of license they had. And we saved them a significant amount of revenue by doing that. We see that a lot because, again, if I use an analogy, most everyone on this call has a Netflix account. They probably have a Prime Video account. They have an Amazon account. They have Apple iTunes account. All these accounts, right, where a little bit of money is coming out each month. When times are good, nobody really cares about that. We really don't pay attention to it. When times are bad, you want to know where every penny's going, right? Same thing here. There are probably things that have been put on auto payment, or you're just paying, your accounts payable person is taking care of each month. We're not really looking into or questioning what they're paying for. Those are opportunities to really assess and understand those expenses better and see if they're valid, right? So with software, Office 365 is an example there. When we talk about hardware, everyone here has some type of hardware on premise, whether it's a server or a Ethernet switch, access points, you name it. Every one of those pieces of hardware have support renewals on them. A lot of times we see practices paying support renewals on hardware that is nearing end of life, meaning that it's not going to be supported anymore and the support renewals are outrageous, or they're paying for support renewals on hardware they don't even have on anymore in their environment and just don't realize it. So these are things that you want to look at, the opportunities for you to look at and see what you have. And finally, we talk about this is kind of a mix of hardware and software, is your backup systems, right? How are you doing backups today? Are you leveraging cloud backup? Are you backing up what you should be, or are you backing up things that probably shouldn't be being backed up, probably should just be archived somewhere, right? I know that we see a lot of practices that are running legacy EHRs, and we walk in there and they're like, yeah, we have this legacy EHR. We haven't used it in 5 years, but we keep it around because we have to, depending on the type of medicine they're practicing and the number of years they need to keep it active just for legacy to access for a patient. And I go, okay, great. How are you backing that up, or is it archived? And they go, oh no, we're backing it up. And I ask them why. That's expensive to back up something that's infrequently used. Archival is a better solution because you archive once and you access it only when you need it. So again, these are the types of questions to ask. How are we doing these things today? Moving forward, questions for your current service provider, right? So these are questions you'd probably ask your, if you've got an IT service provider that's supporting you today, here are the things that are really important to ask them. One, if they're providing hosting services to you, if they're managing your servers, is there a way to consolidate those workloads, right? What we find is that we go into a lot of practices, we find they have, 5, maybe 7 or 8 servers that are running all their applications. And when we look at the applications they're running, we actually come back and say, hey, listen, you can run everything you've got now on 3 servers instead of 6. So we've reduced their technology footprint by 50%. And by doing so, that's less licenses, that's less support costs, it's less hardware renewals, it's less everything, significantly saving them some money. So ask your service provider, hey, can we consolidate some of our workloads? Because I want to look at that and what that impact might be to my monthly service bill. If they're managing desktops for you, are those counts accurate? I know with our clients that are on this call today, our account managers meet with them monthly to do a count validation so that we're not billing clients for machines that have been decommissioned or machines that are turned off or not used. You should make sure that your service provider is, ask them, are they providing you with a monthly report to make sure if you've got 30 workstations that are active, you're not paying for 45. Again, this is something that's easily done, should be easily done, should be an easy question to ask, and find out if you're paying for more workstations to be supported than you have. Are the services they providing you, are they properly aligned with your needs and your budget? So a lot of times we'll see that, we'll get asked sometimes to come in and benchmark what a service provider is providing for a prospect. And they'll tell us that, when we look at the invoice, a lot of times it doesn't match up. A lot of times we see services on there that either A, they don't need, or B, they're not receiving. So again, ask those questions, look at it line by line and really confirm that what you're paying for, you're getting. There could be opportunities for you to save money there, or get what you're paying for. So again, these are some options for you to take back to your service provider. And if there are services that you have asked to be removed, make sure they were removed from your bill. I know that sounds, pretty basic, but sometimes offices have been decommissioned, equipment's been decommissioned. Sometimes it doesn't come off the bill. Make sure, just do that due diligence. Make sure that, what you're paying for, if you've asked for something to be removed, that it was removed. Key questions for vendors. This probably exceeds a little bit. This includes your service provider and any vendor that you find that are key to your business. So questions you can ask them, are they financially healthy? Anyone you rely on heavily, I would call them and go, hey, how are you all doing? Are you all financially healthy? What does the next 6 months look like for you? Have they had any client loss? Are their clients paying them on time? Here's why you want to ask those questions. Hitching your wagon to a vendor that is not financially healthy is dangerous. What you don't want to have happen is one day you call for support and you find out that vendor, had to reduce their staff or close shop and you don't know about it. We've seen that happen. That's happening a lot of places right now where the smaller service providers, IT vendors are not able to manage, they're not able to make it, and they're closing shop. So when that happens, that puts you in a lurch. And so it's important to make sure that, find out how healthy they are. Ask them what concerns they have going forward for the next 6 to 12 months. Do they have a game plan? Are they looking good, right? So those are the key things, again, that you can ask, your vendors, about what they look like financially going forward. I'm going to pause there for a minute. Megan, have there been any questions that have come across to you yet?
We had one question about MPLS. You spoke about how MPLS is sort of an outdated technology standing for multi-protocol label switching. Can you explain sort of what that is and how to know if you have it?
Yeah, sure. So, the thing to do there is one is, take a look at your carrier bill from Verizon or whomever you're writing your paying a bill to each month, and you should be able to see there. You should also be able to ask whoever's handling your IT, whether you're leveraging MPLS. Um, it's purpose built. I mean, it's not so much that it's outdated. It's more about that it's really used for it's used more for guaranteeing bandwidth between locations, multiple locations, and being able to prioritize various types of traffic on those circuits. So today, internet connectivity has evolved, and technologies such as SD-WAN have evolved in the past few years, where they're actually replacing what was once only MPLS, an MPLS type scenario, or being replaced with internet access and SD-WAN. So happy to, hop again. That's an example of, after this call, feel free to reach out to me, and I'm happy to talk more with you about that as part of the Forward Movement initiative, and help you kind of determine what you have, how you move forward with it, what questions you should be asking, and get you those answers. So that's an example of where we would help you there. Again, before I hand it off to Bill Clayton, I just want to thank everyone again for the chance to talk with you today. Again, I wanted to be very brief but focused on things that you need to be thinking about, and why you should be thinking about these things, and how we can help. Again, this is my contact information. If anyone would like a copy of these slides, please let me know, or let Megan know. We're happy to share these slides with you, and would be happy to have a conversation with you about learning more about our Forward Movement initiative and what that's about, how we do that. We're here to help you. We are dedicated to this healthcare community. We've been supporting healthcare exclusively and acutely for 20 years. We know it really, really well, and we just want to give back any way we can.
Thank you, Bill. At this time, I will hand it over to Bill Clayton. Bill, if you want to, go ahead and share your slides. We'd love to hear what you have to say about adding revenue during a crisis.
Okay. Let's see. Can you see my slides? Or
not yet, no. Oh, there we go.
Hang on. Okay. Well, similar to Strategic Solutions, we also take a stance of trying to do some analysis for prospects and clients to help them determine where can they be more effective in-house, and what are they doing with their vendor, and how they can either save money or be more effective in that. So part of the revenue is sitting in your receivables, and usually this gets the least amount of attention. And in 1970, Transworld was developed as an alternative to collection agencies by a group of businessmen and doctors who no longer wanted to pay a percentage to get their money recovered. And so I'm just going to ask some of the type of questions that you may be thinking about. But let's look at this. The reason that patients don't pay, it's not because they're bad people. It's because you're competing with all their other bills. And I kind of took a look at this myself, and I jotted down all the things I have to pay. And this is typically for each patient. They're going to pay their rent and mortgage first, and you see the dental or medical statements down at 18. Well, now it's probably moved up to 15 because of the COVID-19. No one's going to movies, dining out, concerts, or sporting events or vacations. So some good news, it's still moved up, but people will always pay their medical bills last because they just feel the doctors are rich. It's not a priority to pay. And so you're looking at how do you motivate them to pay without losing future business. And part of the problem is time. Conventional agencies, you want to wait as long as you possibly can for two good reasons. One, the cost, and two, the alienation factor. But you can see by this graph of the United States Department of Commerce that the longer you wait, the less liquidity there is in your receivables, and this is why a typical agency recovers, 12% or less. So the 30-day billing cycle is just not effective anymore. So if you had something that was cost-effective and diplomatic, you could use it sooner, and that's really what you want to do. You want to be doing more internally in your first 90 days, and that's when the time is just critical. So some of the questions to ask, if I can get this to advance, your vendor, and I like to ask, when you opened your doors 10 years ago or 20 years ago, was your revenue cycle vendor there to invest 25% into your business? And the answer is probably no. And then I always ask, well, then why would you give them 25% of your profits now? But you need to ask, are they licensed and bonded in all 50 states and Puerto Rico? Why? Because people move constantly. And they are, sometimes they've come to your location because they're visiting somebody in your state, but then they're going to go back someplace else. So you need to have somebody that has that ability. Also, do they offer a hold harmless? In today's litigious society, you need to have protection that no matter what happens, you're not liable for anything your revenue cycle vendor does. Do they continue to invest in security and compliance? This is so important in today's world. Recently, last year, there was a couple of hacks into laboratories from their agency got hacked and all the data was stolen. But there's tons of hacks, and you just have to be constantly investing in that. Do they offer a no percentage fee solution? Why did I put that question there? Well, the studies from the American Collection Association, which most agencies belong to, show that 80% of all monies recovered by agencies is through the mail, not the telephone. So why would you pay a percentage? Do they have a client portal that allow you to have instant reporting so you know what's going on in every single account at any given time? Can they handle past due claims? Typically, every practice has 2 to 5% of claims that will go out 90 days and beyond, where it takes up a tremendous amount of staff time to follow up on that. And do they actually show you how to be less dependent on using the agency? Do they help you with patient retention? Those receivables are future business. And if you can get them to pay, they'll come back. But if they owe you money and they're sick, they might be going someplace else. Do you know specifically what is said to each patient? And if you don't you think you should? And if you're doing anything in-house, if you've got somebody working remotely now that's reaching out to past due patients, do you know what they're saying specifically? Because if the practice says it, the practice is liable. If your revenue cycle vendor says it and they have a good hold harmless, then you're not liable. So that's really important to know what you can and cannot say over the telephone. Does their service integrate with your software to reduce FTE time? Instead of having somebody spend hours a month, wouldn't it be nice if it was only 15 minutes a month to handle all the receivables? Do they teach you how to improve your internal efforts and save money? Are they financially strong to survive in any economy? And do they offer a consultant or just a sales rep? You want somebody that's going to be a business partner, not just somebody there to just get your business and go on to the next. What other businesses do you serve? Do they serve? Very similar to Bill's question, you want to know how viable they are in the marketplace. Do you have complete control over the accounts after they've been placed? That's real important because you know there's extenuating circumstances in almost every consumer that owes money. Do you know what their complaint ratios are? Every agency has a complaint or two, but do you know what their ratios are? And I think you should. And can the patients pay you directly and not the agency? Legally, an agency can hold money for up to 60 days and make interest on it. And if the patient pays you directly, then you've got the cash flow sooner and it's your money anyway. So really there's only 4 options that you can do for your receivables. 1, you continue to bill and call and beg and plead, but if the patient's already ignored 3 of whatever you're doing, does it make economical sense to continue? 2, you can just stop billing after 3 statements and write the accounts off. At least you're not increasing your internal costs of follow-up, but you're also out those profits. 3, you can use a conventional collection agency attorney that'll probably charge you 25% on the 10% that they're recovering, so you really lost your profits. And there's a risk of patient alienation and reputation risk. Or 4, this is the one that I prefer, you can use a nationwide fixed fee service that helps you keep your profits by charging an average of $10 an account, and it's so diplomatic that the Girl Scouts can even use it. And I always believe that if a patient pays, a patient stays. So you have to look at what are you doing, how often are you doing it, how are you getting their attention. And in today's world, you know, not everybody's out of work. Some people always have more ability to pay than they have willingness. But they will pay, going back to that list, they will pay for other things they want before they pay their medical bill. So those were my questions that you should ask your vendor. And I didn't want to take up too much more time because we only promised a half hour for this webinar, but wanted to thank you. And Megan, were there any questions? Because I can't see the chat box now.
We have no questions at this time, but if anyone does have a question, please feel free to submit it through the chat, and we can have either Bill Clayton or Bill Lopez give you a quick answer. Otherwise, we will be collecting responses. Feel free to reach out to either Bill Lopez or Bill Clayton for and yes, we can send out slides from both presenters. We'll send out the slides to anyone interested, or the recording to anyone who's interested in that. We're happy to share whatever information.
Megan, can we talk a little bit about a survey that's coming out as well, so we can get their feedback and find out if there's any other topics of interest?
Absolutely. So as we work to continue through this pandemic, we'll be working on a series of weekly webinars to hopefully provide information that is most helpful to you. We'll be sending out a quick survey at the end of the webinar. We do encourage you to respond with your honest feedback and any ideas of topics that you'd be interested in learning more of. Our aim is to be as educational as possible.